You may not have signed up to be the person to know what the patient is going to be responsible for and what the payer is going to be responsible for. But as a medical biller, you're going to get these questions, whether it's from the front desk asking you what this patient should pay for their coinsurance, or maybe it's the doctor who wants to know how much is a specific insurance going to pay for this specific service. Because trust me, they like to ask you those things. You will be responsible for giving them a close estimate of what each of these people are going to pay. Now remember, you never guarantee anything, because even if you call the representatives or you see on the patient's cards that this is a specific amount that they say a $30 copay, $500 deductible, it's only until you actually send out the claim and it's processed that you will actually know how much each one is going to pay. In today's video, I'm going to be going over 3 examples that's going to help you build up your skills in learning how to determine what the payer will pay and what the patient will owe. The closer you are to getting these figures correct, especially for the patient, the less patient statements you will have to send out, and the more revenue you will get on the front end. So just keep watching. So in order to determine patient responsibility, there are 3 things you should keep in mind. First is the payer, which is the insurance company. We like to use different terms, but it's just basically the insurance company like Cigna, United Healthcare, Blue Cross, all of those people. You want to determine who the payer is. Now, if the payer is, let's say, Medicaid, you then know that there will be no patient responsibility, because for the most part, Medicaid pays 100% and the patient doesn't have to pay anything. But if it's Cigna or if it's United Healthcare, the patient may have a copay depending on the specialty and different other factors. But you just want to know who is the payer, who's responsible for paying on the payer side. Then you want to know about the plan benefit, because in order to determine what the patient will owe and what the payer is going to owe, you need to know what are the benefits of the plan. We spoke about eligibility and verification in the video I'm going to link above, and that's going to go through all the things you need to ask to find out about what the patient will owe, copays, coinsurances, deductibles, all of that. Then the third thing you need to know is the fee schedule. And I don't think I've ever spoken about fee schedule on this channel, which is surprising. But the fee schedule is basically the amount that is either going to be billed or it is the actual allowed amount. Now, I'll go into the fee schedule in depth on a different video, but some people use the fee schedule. They use a higher amount to bill just to make sure that they are above the allowed amount, and then others bill out the exact allowed amount. Now, there's a little controversy with that because I know people don't like to do that, but again, I'll go into that in a different video. Those are the 3 things that you need. You need to know who's the payer, what is the benefits of the plan, and the fee schedule in order to determine what the patient's responsibility will be and what the payer's responsibility will be. So what are you looking for to determine the answers to these examples that I'm going to give? You're going to be looking for eligibility, the type of plan, deductibles, copays, coinsurances, out-of-pockets. Again, make sure you review that video that goes through it. I also have another video that talks about specifically copays, coinsurances, and deductibles, so I'll link that also above so that you can get a better understanding of all of that. Those are the things that you're going to basically look for, and it also is going to depend on your specialty, because you may have to look for other things to help you determine this. But I'm going to try and break it down into as simple terms as possible, and hopefully you will get it. So let's jump into example number 1. In this example, the policy plan's year is from August 1st of 2022 to January 31st of 2023. It is a policy plan. Now, the deductible is $1,000, of which the patient has met $600. The out-of-pocket is $3,000, and they met $850 of that. The copay is $30 and the coinsurance is 20%. Now, the coinsurance and the deductible applies to procedures only. Now, the date of service is January 28th, 2023, where the patient had an office visit and they billed out $220, of which $175 was allowed. On February 5th of 2023, the patient had a procedure in office of which $4,000 was billed out and $3,500 was allowed. How much does the patient owe for both days of service, and how much should the payer pay? So the answer is, for January 28th, 2023 office visit, the patient should pay $30 and the payer would pay $145. For the February 5th, 2023 procedure, the patient is going to pay everything and the payer is going to pay nothing. And that is because the patient was no longer eligible for the service on February 5th of 2023. The patient's policy ended on January 31st of 2023. The patient had 2 services done in a couple of days. One was an office visit, which was covered because it was on the 28th, and the other was a procedure, and it was done on the 5th. However, if you don't check eligibility for a patient, you can do a service for them and then they're not covered. So that's why eligibility, or checking the eligibility for a patient, is extremely important. So that was kind of like a trick question, but let's just say that the patient was actually covered for that date of service. Then the patient would owe $1,020 and the insurance would pay $2,480, or they should pay $2,480. So like I said, that first one was a little trick question just to make sure you were paying attention, but you always have to make sure that you check eligibility, because there have been plenty of times when a patient's coverage ends and they have services done just because they came in a couple days before, and we automatically assume that they're covered. Now, in the second example, it is also a policy year plan. It is from September 1st, 2022 to August 31st, 2023. The individual deductible is $2,500, of which none was met. The family deductible is $5,000, of which the whole $5,000 was met. The copay is $60 and the coinsurance is 30%. The out-of-pocket is $7,500 for the individual, of which $500 was met. The family out-of-pocket is $10,000, of which $5,500 was met. The deductible and the coinsurance goes towards the hospital inpatient services. So on August 2nd, 2023, which is the date of service, the patient delivered. They had a global delivery, meaning they had antepartum care, the delivery, and postpartum care, and it was billed as inpatient. $7,500 was billed and $5,200 was the allowed amount. How much does the patient owe, and how much does the payer owe? So if you said the patient owes $1,560 and the payer owes $3,640, then you are correct. Now you might have said, well, the patient still owes on their deductible. But you have to remember, if the patient still owes on their individual deductible but has met their family deductible, then they don't need to then continue to meet their individual deductible. So you're not going to factor in the individual deductible in this example. You're just going to take the 30% of the allowed amount, and that will give you the $1,560. And for the third example, it's going to be a calendar year, January 1st, 2023 to December 31st, 2023. The deductible is $500, of which $500 was met. The out-of-pocket is $2,000, of which $2,000 was met. The copay is $35, and the coinsurance is 25%. The date of service is 6/3 of 2023, and there is an office visit that's what's done and 2 procedures. So there was $5,000 that was billed to the insurance, but only $3,500 was actually allowed. How much does the patient owe, and how much does the payer owe? So if you answered the patient owes $0 and the payer owes $3,500, then you are correct. And that is because the out-of-pocket has been met. When the out-of-pocket is met, that means that the patient no longer has a responsibility. So when it comes to copays, coinsurances, and deductibles, until their plan renews, they would not have to pay anything out of pocket because they have reached the out-of-pocket limit. Let me know if you enjoyed these examples and if you would like to see more. So be sure to like, comment, and subscribe, and I'll see you again in my next video.